I guess this could be a controversial question. If there is a relation to, and obviously there's a relation to trauma and experiences, perhaps being at some of the core of this behavior. If someone were able to heal those traumas, would it be possible for them to heal this behavior?
The behavior, meaning the addiction, or the eating disorder, or, it is a controversial question. There are a lot of people who believe that abstinence is the only treatment or the only course of recovery for addictions particularly. With food, it's a little bit different. People have to have food to eat. And so when we look at the process addictions, the definition of recovery is a little bit different because we can't use abstinence as the base there. I know people who have stayed abstinent from alcohol or other drugs for some period of time and then, perhaps have gone back to drinking and believe that they're able to drink, without a problem or be able to control their drinking, not drink alcoholically. And, I've known people who have tried to drink, control drinking and have not been able to do it. So, I think, the answer to that, I don't have the answer to that. And I think it really has to be a personal choice or a personal decision. I know in the eating disorder field, a lot of times people will talk about having been recovered as opposed to recovering from an eating disorder, and that the thinking is, okay, I had this disorder, I managed it, I figured out how to stop restricting my food or stop binging and purging, and I am recovered from this disease, as opposed to the recovery, which is more of a disease management philosophy that for most addiction treatment centers will take that. This is a process of recovery for life. For me personally, it's a process of recovery, that I'm not ever there, and that the path goes on for me, and alcohol or drugs, for many people play a very small piece of that life. It may be a blip on the radar or a bump in the road, or it may be a huge, gulf or a valley in their road. So, for me, it's the questions that I say, would adding alcohol to my life add any value or any purpose? And for me personally, I can't think of anything.
Right.
It doesn't, for me, doesn't add any value to my life. And so, that's a personal decision that I make for that. But, I think each person has to decide what works best for them. And I think, especially people coming into treatment who've not been able to control their alcohol or drug use, to be able to have, abstinence so that the brain has an opportunity to heal and to optimize the brain to be able to learn other things, I think is really, really important. And so we at Integrative Life Center really, encourage people to be abstinent from alcohol and other drugs or any other kind of addictive behavior, so that the brain has an opportunity to heal and to relearn and to be able to heal, the past traumas and things like that. I think it's very hard to do that if your brain is in a constant state of dysregulation, which it tends to be when it's under the influence of alcohol or other drugs, or it's not being fed and nourished.
So what are the thoughts on the pharmaceutical reality? There are a lot of people who are exhibiting and sometimes are into addiction, and they are also taking antidepressants, or they're no longer using the illegal drugs, but they are using legal ones. So is there a place where that's appropriate? What's the fine line?
Again, I think that has to be a personal decision that someone makes, and I think the tricky part about that is that sometimes it's difficult to make a diagnosis, and that's why sometimes gathering history can be really important. Is a person depressed as a result of their alcohol or drug use, or their eating disorder, or did the depression come first and the person begin using substances or behaviors, food, to be able to medicate and feel better, as a result. One of the things that we do here at ILC is that we stress the importance of nutrition so that people begin to learn how to feed their brain and optimize again the brain as much as possible naturally. We also use different supplements, amino acid supplements, that can help a person, to kind of right the brain, if you will, and give the person an opportunity to begin to heal that brain naturally. One of the things that we know about addiction particularly is that people can experience post-acute withdrawal, which can be last up to 2 years, and so where the brain still is in a state of dysregulation. So it's really tricky to accurately diagnose, is this a result of the alcohol or drug use, or is this truly depression or anxiety or bipolar disorder or any other disorders out there. Things again that we know is that when people begin to feel better, then quite often they are more inclined to continue to engage in a recovery process. So if we, when certain medications came out to help opiate withdrawal, there were, some treatment centers were reluctant to use the medications, and but what many treatment centers said, well, is if we can retain the person in treatment for a long enough period of time, if we can make their withdrawal comfortable enough to keep them in treatment, then we have a better chance of helping them get sober and stay sober, as opposed to somebody going through a very difficult withdrawal, leaving the treatment center because they're in so much pain, physically, emotionally. So, again, I think it has to be a personal decision that, there are some really, effective medications out there if the person truly has a depression or a bipolar disorder or anxiety or something like that. But I think for anybody who has a propensity for abusing medication, it's one of those things that we have to be mindful about.
Mm-hmm. Absolutely. Is it possible for someone to do so many drugs for so long that they really do change their brain chemistry?
Absolutely. Absolutely. And there we have pictures of brains now. Daniel Amen, who's a psychiatrist, has a whole gallery on his internet site of brain scans that he has done, and not just with alcohol or drugs, but also cigarettes, caffeine, and then any number of disorders, traumatic brain injury, things like that. So absolutely we know that there are, that prolonged use of alcohol, drugs, tobacco, caffeine, things like that absolutely have an impact on the brain itself. Mm-hmm.
So that's very disconcerting on some levels.
It is, particularly for me with young people. I work with a lot of adolescents in my private practice, and what we know now about the human brain is that it's not fully developed until about age 25. And so, you introduce a toxic substance into the brain at an early age. 11 is about the age that, the average age that kids are being exposed or introduced to alcohol or other drugs. And so, you put a toxic substance into a brain, and it interferes with the brain's ability to develop properly. And what we know now from research is that, the earlier a person begins using on any kind of regular basis, the greater the chance of them becoming addicted to substances later on. So for young people particularly, I think it's really, really important to continue to educate young people and to have prevention and early intervention programs in schools. And I know a lot of schools just don't fund that any longer.